Tonight, we're digging into a problem a lot of parents face. How much is too much screen time? You ask this of yourself all the time at home, right?
Just all the time. You're right. A team from Children's Hospital of Michigan is sounding the alarm about what they're seeing. If you were watching at 5:45, you heard from a pediatric sports medicine physician and a physical therapist about the injuries they're treating. Well, now a pediatrician and a psychologist are sharing their concerns and what you can do about it.
Dr. Tiffany Widener is a pediatrician at Children's Hospital of Michigan. She's concerned with the number of children she's treating for bone and muscle ailments. Ailments she says are usually older people problems.
Especially around the spring and summer when they're starting to become more active, they start complaining about their knees and their backs and their necks because they're having a lot of pain because they spend so much time looking at screens. But usually you'll see this with your older populations because they typically live more sedentary lifestyles.
The effect of too much screen time is not only physical. Local psychologists are also seeing the effects in children mentally.
What types of psychological effects are you seeing on children that come into your practice that are using a lot of screen time?
Well, a few things. One, I see them to be more like isolated socially, so they're by themselves on the screens, iPad, phone, earphones in, so you can't interact. So the kids are often by themselves. The social skills is an issue too, because if you're not able to interact because you're all into whatever you're doing, the opportunities to be social and to learn are not there.
So what do we as parents need to do?
So we need to get back to doing things as a family and as a group because it has to be replaced with something else. So board games, what happened to family game night? Playing cards, Monopoly, Chutes and Ladders, whatever you have, we need to go back and get those things that we stopped buying because we had our screens. But even implementing family screen time, so those family-friendly movies, and then having discussions.
We'll set a good example for the parents also to put the phones down during mealtime and make sure that you're doing what you're asking your kids to do, is like to talk to you and to be engaged. That means you have to put the devices down and actually talk about things or play with them. Maybe they're bored and you would like them to find something to do, but if they're having trouble because they spend a lot of times on screens figuring out what else to do, maybe get started with them and do something with them and show them how to play or how to pick up some other things to do other than electronics.
So not just having empty screen time where no one is having a benefit from it, but utilizing that in a way where you're engaging your children.
Now, there was so much more from the medical team at Children's Hospital of Michigan. To see an extended cut of my special reports from 5 and 6, head right now to clickondetroit.com, and you can also find it on our YouTube channel.